Ecstasy, also known as MDMA, is a stimulant that is classified as a Schedule I drug, which means it has a high potential for abuse and no medical purpose for it. Though it's a stimulant, it acts like a hallucinogenic as well. Ecstasy is also often taken as a pill but can be crushed into a powder and snorted. The effects of taking ecstasy usually begin within 30 to 60 minutes of ingesting it, and they typically last for 3 to 6 hours after consumption. The effects of the drug depend on a person's weight, health, and how often they take the drug. MDMA was created in 1914 by Merck. It was thought that it could be used as an appetite suppressant. In the 1970s, it was given to psychotherapy patients because doctors thought it would help their moods and other aspects of life. But in the 1980s, it was banned in the US due to studies that showed that it caused brain damage. Unfortunately, in the late 1990s and early 2000s, it became popular among teenagers and young adults. Recently, in the past 15 years, teenagers and young adults have begun to take ecstasy at parties or clubs to increase their energy to dance and party longer. But taking ecstasy combined with being in hot, crowded places leads to dehydration. Dehydration usually leads to an increase in body temperature, which can lead to muscle breakdown, kidney, liver, or cardiovascular failure, and that can ultimately lead to death. A person may think that if they drink a lot of water, they will not get dehydrated, but drinking too much water on ecstasy is a bad combination. It could cause brain swelling and cause a person to go into a coma and possibly die. Ecstasy affects 3 neurotransmitters in the brain, including serotonin, dopamine, and norepinephrine. Taking ecstasy releases large amounts of serotonin from the brain, which takes a while to rebuild once the drug has left the brain. There are many short-term effects of taking ecstasy. The most prominent effect is that it produces an intense, pleasurable feeling. It enhances a person's self-confidence and energy. It also causes a feeling of closeness to other people. People on ecstasy are more sociable and have an easier time getting to know other people because their anxiety levels decrease. A person's heart rate and blood pressure also tend to increase. Some other minor short-term effects include involuntary teeth clenching, fixation on lights and sounds, nausea, blurred vision, and sweating. There are several after effects of taking ecstasy. Feeling fatigue is one of the most common effects because of the increased energy your body had for several hours. Many people report feelings of anxiety and depression. This is a result of the brain's inability to establish normal levels of serotonin in the brain. Other after effects that occur because of a person's serotonin levels are off include lack of concentration and motivation, impaired attention, irritability, and loss of appetite. A person may also have soreness in their jaw as a result of the involuntary teeth clenching while they were on ecstasy. Insomnia is also another effect of taking ecstasy. The major long-term effects of taking ecstasy is the damage it does to the brain. Ecstasy damages brain cells in the brain that produce serotonin. Serotonin controls mood, appetite, pain, learning, and memory. So when cells that produce serotonin are damaged or destroyed, a person faces problems in one or all of those areas. Most people experience mood swings, loss of appetite, problems in learning new things, and inability to remember new things due to low levels of serotonin in the brain. Ecstasy is a very highly addictive drug. It is very addictive because most forms of ecstasy nowadays are mixed with other kinds of drugs as well. People tend to usually go through withdrawal after 12 hours of consuming it. Some of the symptoms people show that they are going through withdrawal include cravings, insomnia, difficulty concentrating, and restlessness. Some more severe symptoms are anxiety, depression, panic attacks, and delusions. The best way for a person to overcome their addiction is to enter rehab. Following rehab, it is recommended that they receive individual and group counseling to help them stay clean. Although ecstasy is a very addictive and dangerous drug, there are studies going on to test the possible medical uses for it. With one study conducted to test the effects of giving people with PTSD a form of ecstasy 3 times. So far, they have found that these people have had great improvements in life. Ecstasy is also being tested on people with terminally ill cancer. It is believed that ecstasy reduces pain and helps to make their final weeks or months more bearable. But there's not much information yet due to the bad reputations that ecstasy has.